what we're trying to do. So people have more money for all the things they want.
We want to give Jeff, who's been waiting so patiently. Jeff gets the last question.
Congresswoman Davis, I would also like to thank you for having this forum and for allowing people not in your district to be able to come and ask questions, because as you said, you're the only one that is actually offering a forum like this for us to ask. I am not in your district, but this healthcare bill will affect me, my wife, and our future children's lives directly. And so it is a very big concern for me, and so thank you for letting us come here and ask these questions. I would like to ask, though, in reference to my children and to my future, how are we going to pay for this? You say that it is deficit neutral, but we all know that that is a lie, because what you're going to do as soon as this one starts costing more than you say it will, is you guys will pass another bill that will just tax us more, that will take more, that will eventually run into the deficit. It will not work. We already have $11.7 trillion in federal deficit. That doesn't include Social Security, Medicare, and Medicaid, which are going to be going broke in the next couple of years. How on earth can we pile this on top of it? We're not going to have savings. We know that the government, whenever they get into anything, they spend more money because their cronies that they get in bed with, they charge more to pay back for the kinds of money that they get paid for their campaigns. So how can you honestly, and with a straight face, say to us now and here today that this is not going to add to the deficit when you know, I know, and the vast majority of the people here know that it is going to bankrupt this nation even faster than it already is.
As you know, there are some plans to place about a 1% surcharge on those making well over $250,000 a year. That's one plan.
Taxing the rich only works as long as the rich have money. You keep taking their money, you're not going to have the money for it.
However,
the CBO says it's $1.2 trillion in the hole.
don't forget, this is a bill that has to get through the Congress. And even though there are a number of members that don't have to necessarily draw from the other side, they represent communities just like this all across this country. And we all are interested in pay as you go. So we're watching that. I appreciate the fact that you're not here from the district and that you didn't have an opportunity to go to a forum in yours. Thank you very much for being here.